So my name is Christie Long. From the simplest of terms, I'm a small animal veterinarian. I graduated from Colorado State University, go Rams, in 2007. I've been here with Modern Animal for 3 years, and my title here is Vice President of Medicine. And as such, I'm responsible for all the doctors in the organization, creating career development and growth for them, as well as our medical standards and quality. So, and I also feel like I get it, as you do as well, being on the front lines every day, being a practicing veterinarian, knowing and seeing firsthand how stress and strain has compromised mental health of our colleagues. Mm-hmm. So, yeah.
Thank you.
Thank you.
Hi everyone, I'm Bethany Weinheimer. I'm an emergency veterinarian and I work for Veterinary Emergency Group. Right now I am an area medical director for the West Coast. I went to Texas A&M for undergrad and veterinary school, so gig 'em to all my fellow Aggies out there. And I've worked on the floor for many years as a practicing emergency doctor, so we definitely have burnout, compassion fatigue are all things that we experience on the floor. And so we're so happy to be here with you guys and representing VEG from the standpoint of opening up the conversation and creating awareness to all of our fellow veterinarians and everyone in our profession.
Thank you both. I'm so looking forward to this dialogue. I encourage everyone listening to practice some self-care during our time together. You know, grab some water, make some tea, whatever people need.
Yes, ma'am.
Take a break. If the content is activating at all, I encourage people to tend to themselves during this time. We did source some really good questions from your team members, so we'll make sure to have time towards the end to answer those. So first, as an opening question, diving right in, what makes the veterinary industry prone to burnout? Dr. Long.
Wow. Well, there's a lot to unwrap there for sure. I think, if I could just cite a couple of key things I see, right? It's you're dealing with people often at their worst. They are worried about a creature that they love very much. And often they don't have the financial resources, or even if they do, it's often a financial decision regarding how they proceed with care. I think the veterinarian is often in the position of knowing they can help and wanting to help and knowing what needs to be done, but the owner does not have the financial resources to proceed. So that's obviously a very stressful and difficult time for all concerned. That makes it very difficult. I think it's also a profession that many people who are in it have wanted to be in it, since they were kids.
Yes.
We were just talking about that before we started, right? And there's just a huge drive and a huge pursuit of excellence on an individual level that I think kind of has us holding ourselves to a standard that may not really be achievable. And let's go ahead and put a name on it. Is it perfectionism? I think perhaps for some people, and that's not really realistic in really any case. So it's hard to measure up even to our own personal standards that we have for ourselves.
Yeah, that's so well said. And that's our biggest strength. We want to embrace all of that compassion and care, and we want to have high standards and, be aware of what costs. Totally.
Yeah.
For me, it's actually taking a step back and saying, what actually is burnout, right? So it's a mental or physical collapse due to overwork and stress that we can experience. And we definitely have both of those components in veterinary medicine, especially emergency, which is something I can speak to because it's all I've ever done. So let's actually break down what those dimensions look like. So there are 3 major dimensions that we see when it comes to burnout. One is that we start to get apathetic and we don't care. We actually separate mentally. One is that there's just severe exhaustion when you leave your shifts or when you walk in before you even start your shifts. And then the last one that we can actually see is just completely turning off and actually developing negative feelings toward our profession and developing a cynicism towards what we experience day to day. And those negative feelings can actually apply and I guess kind of like revert those feelings that we've always wanted to be a veterinarian. And all of a sudden one day we wake up and we may not feel that way anymore. And that's like a huge challenge that we see day to day in our environments that we definitely want to fight and open up this dialogue so we can talk about it more.
Yeah.
I think the other thing that we can see when it comes to burnout is actually comparing that to compassion fatigue. So compassion fatigue and burnout are actually separate. Compassion fatigue is directly related to secondary trauma that we see. So if you watch a coworker get mauled by a dog and you're standing there helpless, that's that secondary trauma that you can experience. And when we don't deal with those things, that compassion fatigue can build and lead to that burnout too. So it's so important to have these conversations, these times where we can bond as teammates and come together from different organizations and really open up those conversations so we can say, hey, I experienced this, it was really tough. Like, let's talk about how to make it better for everyone.
I love that you define it. I think that's really important to give us common language, to give us context, because so much of this work starts with awareness, you know, self-awareness, organizational awareness, industry awareness. So thank you so much.
Yeah, for sure.
How has the pandemic affected the veterinary industry in terms of mental health?
For me, it goes back to that definition point. You know, we talk about being overworked, being stressed, and I think with COVID, we had huge spikes. At least I can speak for my hospital that I was running in Fort Worth at the time. We went from 1 month, we had normal animal caseload, normal patient caseload, and then all of a sudden it's tripling within 3 months, and we still have the staff for that same number that we had 3 months ago. So numbers went up, we skyrocketed. Staffing shortages that we had at the time, as well as just, I think a huge piece for us was the isolation. And so at Veg, we, you know, got our teams together. We went and did SOS recruiting. We hired a ton of people to make up for that gap. And then we also had a component of, like, we crave that togetherness. And so we try to create ways for our teams to be together outside of the work environment as well as inside, and really build a family inside the walls when you're sometimes separated from your family outside of work.
Yeah, it's interesting. We and we were speaking about this earlier. Our hospital opened at the pandemic, so you know, we used to say, when are we going to go back to normal, when we really never had been normal. And so I think that's a great point, you know, regarding just building that family and that culture inside the practice that allowed everyone to just really come together during a super difficult time. But I mean, the huge influx of pets in the system was crazy. I mean, we were booked out 3 weeks, obviously different from emergency. You know, we're a general practice, but you know, all you see ahead of you are patients, right? And it was very difficult for our doctors and for our staff to, you know, take care of themselves during that time. I mean, there was, right, not that long ago when, you know, we were very, very worried about, you know, just getting COVID from incidental contact and not understanding. I mean, do we remember when we were worried that dogs could bring it in on their fur? And if I'm intubating a cat and it has COVID, am I going to get COVID from the cat? I mean, there were so many unanswered questions. And we just had to keep going, right? We're essential workers. We got to be there for people. We got to do this. Going back to those standards we set for ourselves. And our team, you know, never let those folks down, but it took a toll for sure.
It's so important to acknowledge that toll and not just kind of move forward without recognizing how hard it's been.
Yeah.
and that impact on mental health. And also, you know, I hear you both talking about the strengths, you know, the resilience and the grit, and how crisis can also bring our teams together too.
Yeah,
it's both.
I think it's interesting to think too from the client communication standpoint, you know, during curbside and communicating with folks on the phone, or in our case over video. But you know, we used to joke, what would veterinary medicine be like with no clients? And we got what we were wondering about, right? We saw what it was like, and it wasn't a good thing, you know, because you know, the communication that's already hard for you guys in emergency situations, life or death, you know, it made it that much harder and difficult to really work as a partner, I think, with clients. So that was also a big factor as well.
Yeah, our hospital in Fort Worth opened curbside too, and so I remember us craving that togetherness with the clients. And once we were finally able to transition outside of curbside and letting owners back into the treatment areas with their pets, which is something that's unique to Veterinary Emergency Group, having people with their pets and letting them be together really did improve our communication style and really helped, one, the patients stay more comfortable, two, the owners stay more comfortable. And honestly, I think we as veterinarians were super grateful for the opportunity to have them there too, because they appreciated all of our skill and knowledge, and they're able to thank our technicians for all the hard work that they do. And there was a huge laugh lack of that when we were curbside, which was exacerbated by COVID.
Yeah, we do the same thing, actually. We invite folks to come into the treatment room, and everything you just said is so true about that. Makes the team feel proud of their skills as well. So yeah.
So many challenges and growth moments.
Yeah.
So thinking about well-being, is the onus for well-being in vet med on individuals or organizations or the profession at large? So comparing and contrasting approaches to keeping ourselves well versus increasing well-being in the workplace, and then changing industry norms and culture, whose responsibility is it?
I mean, that's such a good question. There's responsibility to bear in all three groups, but I think, the biggest place that we can make an impact is as a company. I like to say, there's nothing wrong with the players. You have to change the game, right? Veterinarians have always been great people who want to do good work. That hasn't changed, but the game has definitely changed, and it was changing before COVID, but it really just accentuated a lot of that, I think. And I think you really have to, as a company, stand up and say, we are going to be the ones to say, what, as an example, right, we're not going to squeeze in patients. We're not going to allow, our teams to continue to see more and more cases past the point where they can reasonably do so. The schedule is the schedule, and that's what we live by. And that's just an example, I think, where as veterinarians, we always want to please people. We don't want to say no. We can still find a way, right, to help them, but it has to be. I think we have to learn to draw boundaries for our doctors themselves. I mean, I think doctors are notorious. Sometimes I have had doctors that I have had to take their vacation. Because they literally did not want to stop working and let folks down. But, so I think as a company, it comes from us, right? We have to start and say, guys, this is how we're going to run our business, and this is what we're going to do. And it's, yes, you have responsibility on your own to keep yourself well, but we have to put the tools in place to allow you to do that. So.
Yeah, I think all three groups should be held accountable. And I think we all need to take ownership of our part of it. For me as a veterinarian, I know that I'm predisposed to compassion fatigue, burnout, depression, suicide. Like, I know I'm at a higher percentage of that. So it's more important for me to take action and have mental health days set in place for me to know how I can release that energy, for me to take initiative on that. As a medical director, I have those questions with my staff. What's your goals this month for your mental health? What's your goals this month for your physical health? What vacations are you taking this month? Tell me, and I'll hold you accountable. And maybe it's just, watching the sunrise and having a glass of coffee two mornings every week, and that's great. Or maybe, you want to go to a workout competition, and that's how you release your energy. Whatever it is for you is what's important, but I'm their guide and I'm their partner in helping them find out what that is and holding them accountable to it and letting them talk to me about what it's like. And then also from an organization standpoint, we shouldn't be tolerating yelling in our workplace. We need to create psychologically safe environments for our employees. We shouldn't be letting people gossip. We should be able to say a simple word that reminds people to, push those things off to the side and really focus on why we're here, which is helping people and their pets when they need us most.
Yeah, that's such a good point. Just the culture of the practice, right, and how that feeds into mental health. And I think, helping people understand that we're not going to place blame here, right? Yeah. Whether it's to our coworkers or to the clients, it doesn't matter whose fault it is. We have to move forward and do our jobs and take care of patients and work together in harmony. So, yeah.
Everybody does their part.
Yeah,
we'll all
for
get
sure.
better.
For sure.
No shame, no blame, no regrets, I always say.
Oh, that's a good one.
Sounds like a tattoo.
Yes. I don't know if you noticed me light up. You both said my favorite words, boundaries, accountability. Those are such important themes to normalize when we talk about well-being. On an individual level, self-care and individualized approaches and practices, and then community care and how we take care of each other.
Yeah.
Is it possible to provide the highest standard of extraordinary veterinary care and medicine and be a leader in the field in burnout prevention? I worry sometimes it feels like we need to pick one or the other. There can be that tension. So I'd love your thoughts about what gets in the way and can it be done? Can we have both?
Yes.
Gonna dive in? Yeah, I mean, let's hope so, right?
Yeah, I mean, I think you can pursue medical excellence and still pursue a great culture at the same time. That's what we aim for at Veg, that kind of blend of harmony between customer experience and medical excellence and all those things. If we're doing things to protect our people and make them happy, they're gonna do the same things to make sure the client has a great experience in the hospital because they know they're taken care of, they wanna take care of others. And so we're kind of just taking the approach of pay it forward. You know, we give our doctors and our nurses unlimited CE, which they want to go and learn the skills. They learn the skills, they come back more confident, they offer surgeries, they save more lives. So it's constantly just like a pay it forward type model. But I think by doing that, we're also giving the opportunity to be medically excellent and also have an amazing culture.
Yeah. I think you can absolutely do both if you, again, put the tools in place for the team to be successful at doing so. And I mean, that doesn't mean 30 patients a day, 10 of which you see over your lunch hour and the other 20 you see, the rest of the day, because you can't. Right. You can't be a medically excellent doctor by doing that, and you sure can't take care of yourself or your team doing that. So again, it goes towards creating a model where you allow your doctors the space to do what they need to do. Fear-free is a big thing for us. We're all fear-free trained. We practice fear-free techniques. That takes time, but at the end of the day, the animals are in a much more comfortable place. They feel more comfortable in the environment. The clients feel more comfortable. It just creates a better space for everyone that allows us to, I think, give that great medical care, right? Whether it's, let's talk through all the options that you have in front of you today, and let's choose the best one for you and the pet, or just making sure that the pet has a comfortable and safe feeling around them. So yeah, I mean, it's definitely something that I think we're striving for.
I love that. I love they're not competing, they're connected.
Yeah.
Like they're interconnected, and they build off each other. It builds, in my experience, it can be contagious. Like it builds exponentially when you're having both. Yeah.
Well, as a doctor, I have to say, like I would feel more burned out if I felt like I was not practicing to the standard of care that I have set for myself, right? And that I hope all my doctors and they have, right? So that directly feeds into my burnout and my own mental stress more than anything else, right? If we can create an environment where people feel like they're doing their best work, then they will, I think it will, help assuage a lot of burnout.
Well said. We know that good practice climate, which we've already touched on some, is a powerful predictor of good mental health and a high level of well-being for our teams. What role do leaders, so think about formal leaders and informal leaders, play in creating a good environment in the workplace, in your practices?
I mean, there's so many ways, right? Again, it's the things that you put into place. We were talking about using, apps to access, licensed therapists or, aid you in helping you develop a meditation practice. Personally, for me, I'm just gonna admit this, like I have to model the behavior, I think, first and foremost as a leader. If my team sees me, we use Slack as an internal communication tool, for example. If they see me on Slack on the weekends or after hours, then what is the message that they send? If they see that I never take vacation or that I'm on vacation but I'm still communicating and working, then that is, I'm absolutely not modeling the behaviors that I want them to have, right? So I think as a leader, it's paramount that you show your team that you value, ways to keep you from feeling burned out.
There's a 2015 DVM 360 study that talks about the top reasons that we experience burnout, and some of the major stressors that they identified were time management, difficult clients, difficult employees, and then financial burdens that the clients have. And so those are all key components that Dr. David Bessler and I gave a lecture to IVACS last year that was focusing on some of those components. And so what can you do to help manage time? For you guys, you can set up appointment schedules, which is super great. In the emergency, we can't really control that. But what we can do is our doctors were staying really late to write records. Sometimes, they would have 8 hours of records after seeing, 40 patients in a day because they all come in on, at the same time. And so you have an overwhelming amount. And so our company helped create scribes. And those are people that get to help follow the doctor around, help fill out the record, make sure that we're getting those complete so we can have that work-life balance. And then, difficult clients. So what are things that clients get upset about? Separation. So you guys do that too. And that's something that Veg does uniquely for an emergency setting. And so we are able to bring people together with their pets. So, think about it. If you had a child that was going through an emergency, the last thing you would want to do is be separated from them. Right. So in that environment, we can bring them in. So we're taking away some of that difficulty with the clients. With the coworkers, we're trying to make it an environment where they love coming to work and there's less drama or gossip. And so that alleviates that concept too. The no yelling thing is really important to us as well. And then the last is like the inability for clients to pay for things or the financial burden. So what can we do as a company to provide options for that? Well, we offer care credit, scratch pay, Veg Cares as an option. And honestly, sometimes we give our doctors the autonomy to give things away for free. If an animal needs to get to its regular veterinarian in the morning for a pyometra surgery that they can't afford with us, maybe we give them some sub-Q fluids, Cerenia, and antibiotics to go home so they can wait throughout the night to get to you guys. And so we have that autonomy, so there's never a time where an owner gets in my face and says, you're only in it for the money, because we're not. And that really hurts, and that's traumatic for us. Yes. And if we can do something simple, like give away $200 of medications, worth it, worth it for the mental health piece. So what are those things that we can do as a company to alleviate those major stressors? There was only a 1% from euthanasias that actually created stress. So it's kind of ironic that people outside the industry say, oh, you must be really stressed. But the reality is like less than 1%. To a lot of veterinarians, that's a gift that we get to give to animals, So I think that that's our role as leaders in the hospital, in addition to being that accountability partner for our teams, but really trying to create that environment where we can be successful as veterinarians and veterinary staff.
Yes.
Yeah.
Yes.
I think there was also a human doctor study. We always call them human doctors, right?
Yeah.
Regarding burnout, and it actually also found that being asked to do things that you don't feel competent at or capable of is a major factor of burnout, at least for human doctors. So I think what you guys are doing with respect to unlimited CE is a really great way to start addressing that. We're developing a mentor program, so our doctors feel comfortable dealing and helping other doctors learn skills that they need. So yeah.
Yes. You all just said so much that I want to amplify.
Go ahead. Go ahead. There's a lot to dig out. Yeah,
there is. I think good leaders listen for those creative solutions. I love that all your examples were concrete. This doesn't have to be abstract. There are things we can do. Listening to our team and then executing those creative solutions. Totally. And then role modeling is it really is huge. We need to walk our talk. My team has heard me say a lot that I'm personally really motivated by not being a hypocrite. I want to always practice what I preach, and that creates culture. Totally. How can we have these exact conversations like we are today in a balanced way, in a balanced manner? We do want to validate people's experiences. I always want to agree that it's real. Exposure to suffering, burnout, compassion fatigue. And then also we want to emphasize and normalize resilience and grit and help seeking. So how do we make sure the way that we're talking about mental health in our industry is balanced?
That's a good one. I mean, I think acknowledging and kind of giving a name is a big part of it, right? And saying, I can understand why you're feeling this way. I felt this way myself, or relating stories, from our past that we've dealt with. But then, I mean, grit it's one of my favorite books. Just talking about resiliency and the ability to deal with, what is coming at you. I mean, I remember at graduation, they said to us, to whom much is given, much is expected. And I've always thought, I don't think before that time I had really thought much about the position I was stepping into as a veterinarian. And what is expected of you. Now, that can't come at any cost, right? And I think we have to continue to support our teams and remind them of that, and give them the space to come forward and be present with that, but also know that we will support them in their endeavors to continue to develop that resiliency and just become better doctors there.
Yeah, I think having that empathy piece, but also there's something that David Gladstein always talks about. He's our president, and he talks about work-life harmony. And like, can we bring our work, like, can our work become our family? Can we bring our families into our work? And, you know, like, if there's a work event, can we bring our families? Like, can we create this symbiotic relationship between our culture at work and our culture at home? And can we build those things together? I have a couple of my doctors at Veg Katie that actually go rock climbing together now because it was part of their initiative. You know, we had conversations about it being tough, and then they executed by going outside the hospital and doing something fun together. So I think it's meeting people where they're at when they are having a tough time, and then also being able to create a plan. Hey, I know you're going through this tough thing right now with COVID. This isn't going to be forever. Like, picture this, and let's create solutions so we can work towards this goal together. And in the meantime, like, find creative solutions for, you know, that release, like whether it's rock climbing or yoga, whatever it might be for you.
Yeah. I think sometimes too, you have to realize when, you know, the business isn't the primary concern, it's the individual, and you know, it's great as a leader knowing that you have the flexibility to say maybe you need to take time off at an extended amount, and to be away from work, and being able to recognize that, and having the support of an amazing team, you know, to help you do that is so empowering, at least for me, to know that, you know, the individual matters, you know, more than the business in that case, right?
Yes, it's complex. It's not any one thing.
Yeah. It's individualized like the individual, right? And I think having that approach will serve you well.
Yeah. I added this question because I worry sometimes we have these narratives or kind of cultural scripts in the industry that are, you know, have been around, you know, about perfectionism, about self-sacrifice. Do you think we're moving away? Do you think that there are these industry norms that are changing towards maybe being more balanced?
I'd love to hear what you think. I know what I think.
Yeah, I mean, I think we're definitely on the path to creating a different environment. You know, I grew up in small town Texas. The person that I shadowed when I was a young high schooler was very much like, I am a veterinarian. You know, you didn't have much of an identity outside of that. So when someone calls you at 2 a.m. in the morning, you show up and you help treat the horse, and that's what you did. Versus now, I think we're starting to see, yes, I'm a veterinarian, but I'm also like, I'm a photographer, and I'm, you know, an active hiker, and I'm a camper, and like, I like to play with my friends outside of work, and like, we have so many different avenues that we can define ourselves by, and we don't have to be one thing. And I think that is like the journey that we're on as veterinarians now, and companies. We're seeing everybody as individual, and not just this is who you are, but this is part of what you are. And so it's always fun to ask the question, what are you outside of veterinary medicine? Like, describe that for me. What do you like to do? And so just how we ask our doctors, like, what vacation are you going on? We often ask, like, what exactly are you outside? What do you enjoy doing? What can I, you know, do with you to build that relationship? So that's my opinion.
Like foster dogs or do spay dinner clinics.
Yeah, exactly. It might be, and that's totally cool. Like, whatever brings you joy.
Absolutely. I think it's absolutely changing from the inside, and I think it's a damn great thing, honestly, and maybe, you know, I don't know if it's the feminization of the profession, you know, for better or worse, and I am a mom, like, we do tend to be the primary caregivers a lot of times, and this is becoming a profession where women are standing up and saying, and you know, that we are 80% of veterinarians at this point in time, right? Like, I can't sustain this. This has not worked for my life. I have other things outside of work, whether they be rock climbing or my 2-year-old, and that's I think that I see that happening in overwhelming numbers, and I think it's changing outside of veterinary medicine too, right? More and more people are realizing, you know, you only get so much time on this planet, and it's a wonderful life, and you have to take care of yourself and live it to its fullest. And while it's very important to have a satisfying career, it's no longer the only thing for people, right? Whereas the vet who woke up at 2 o'clock in the morning to go stitch up the horse, right? A lot of times it was expected that was their life.
And you know, they didn't really have any other options too. You know, now general practitioners have places like Veterinary Emergency Group
You
where they
guys.
can refer.
Yeah.
And same thing, like if we're overwhelmed and we have a ton of ear cleanings, we call you guys and we're like, hey, do you have any availability, you know? And so we have that partnership and we can all help
Right.
each other. And I think this just brings, to me, together the heaviness and the importance of these types of conversations where we can collaborate, because we do all need each other for us to all live a healthy, balanced lifestyle. We need each other, and we don't need to be like, oh, this company versus this company. What we really should be doing is coming together so we can help each other all be successful and save our industry as a whole.
Clients need us too, you know, there's no question about it, and our patients need us too, and I think we just have to find a way to help them on terms that work for us, and I don't think we've ever applied that filter to it as veterinarians. It's always just been, here I am, come one, come all.
Right.
And I think we have to think about the problem differently.
Yeah, a paradigm shift in some ways,
Yeah,
while
yeah.
still respecting all the legacy and all the history, and then shifting perspective. Yeah.
For sure.
We've talked, we've referenced doctors a fair amount in our conversation. How do you support your support staff, your technical team, your nurses, and your CSCs and the rest of the hospitals?
All the people that make it work.
Yeah.
Right?
Yeah.
That allow the doctors to do what they do. I mean, I think our approach to it has been, you know, creating roles, creating expectations so that people understand, you know, where they should be performing, and then helping them get there and get to the levels they need to be at. It's also letting them do their jobs. You know, hey, here's an idea. I had a new doctor start a couple weeks ago, and she said, I didn't touch a syringe one time today. Right, because you're a doctor, and we, you know,
Nice.
that is not your role.
Nice.
We have an incredible team of people who take great pride in doing a great job at that. And to your point, clients love seeing them do their work. Let's highlight that, right? Let's show people their incredible skill set. Whether it be, you know, the ability to vaccinate a dog without it even knowing it got stuck, or draw blood from the tiniest, smallest kitten. That's important that people see that. And it's important that we acknowledge the importance of their skills and abilities. I think also, you know, just another quick plug for our virtual care team. You know, these are very deeply experienced people who have many years in their profession as veterinary nurses, and we are giving them a way to continue contributing to the profession, right? Helping clients by being there for folks, to help them work through, do I need to go to veg at 2 o'clock in the morning, right? Or can this wait until the morning? So I think it's just recognizing and building those folks up is one aspect of it, for sure. It's not the only answer.
Yeah. I think in our hospital setting, we really focus on the appreciation point for either our nursing teams, reception team, whatever it might be. We're currently working on creating new growth patterns and models for what our nurses can do. So really elevating and challenging what they can do as nurses, and that's really encouraging our nursing team so they feel like they always have options to grow, but they don't have to leave the medicine side. We're also trying to push the boundaries of what we can pay our nurses, our veterinary nurses, so they don't have to work multiple jobs.
Yeah.
And that makes them feel valued, right? And it makes them feel appreciated. We try to do small things. Every quarter, the hospital managers and the medical directors meet with their individual nursing team, reception team, and we have meetings that focus on goals. Let's write 5 SMART goals. Tell us what those look like, and we'll help you throughout the next quarter work towards those. We do something simple like quarterly outings, and now that COVID is kind of like passing, I guess we didn't do it as much during COVID, but now that it's somewhat passing, we're able to kind of do more outside events and really make them feel special. At Katie, we had a Super Bowl party, so my hospital manager and assistant hospital manager did an outside like blow up thing. They played the Super Bowl, and we like made tacos outside of the hospital. So the people working that busy Sunday had food, and then the team came to them. And we even provide like weekly healthy food options for inside the hospital. So we'll buy $200 worth of groceries and put it in there. So if they don't have time to eat their meal that they prepared and brought to work that day, there's still something healthy that they can pop in their mouth between all the emergencies that they're seeing. So I think it really boils down to showing appreciation and valuing what skills our nursing team and receptionists bring to our overall concept as emergency doctors. Because I'll believe you that all doctors on the floor know that they can't do their jobs without successful nursing assistant and reception teams, and we really love and highlight that. And having, like you guys said, owners in the back, they get the appreciation. They realize the doctor mostly sits at the computer and type notes and places orders, and then they realize how much the nurses are sitting there caring for the animal, you know, convincing them to eat the food that they need to eat after their surgery, whatever it may be. But they really get the highlights from the experience because they do the hard work.
For sure.
We're so interdependent.
Yes.
It's true. And I'm glad you brought up salary, because we know mental health is tied to financial stability and child care, and just like it's complex, the solutions are complex. It's not any one thing. So I'm glad we talked about a variety of approaches for supporting the whole team, the whole hospital.
Well, I mean, there's another area that COVID's put a lot of pressure on too, right? I mean, it's hard enough going to work. It's hard enough. It's much harder going to work during a pandemic. And if you're not being adequately compensated for it, you know, at some point you're going to start looking to do something else, I think. And I think I think other companies have seen that during the pandemic. They've lost a lot of support staff, and it's been very challenging, but you have to value those folks in your business. It doesn't work without them.
Yeah. Yes. I definitely see that in my hospital. Our people are our assets. Yeah. That they're it. Totally. Okay, moving towards some of our questions from our teams. Really great questions from everyone. The elusive work-life balance is a huge factor in burnout. So many people are now embracing the positive changes that come with working from home. Any advice for us in the clinics working long hours when remote work is not an option? Work-life balance.
Work-life balance, yeah. We talked about it a lot today. What did you say your CEO calls it?
Work-life harmony.
Harmony, yeah, exactly. Keeping them together. I mean, you know, I mean, making sure your staff leaves when they're supposed to leave, right? You know, someone keeping an eye on that clock and making sure folks are clocking out and getting their work done, moving folks into their role. And then, you know, I continue to go back to the idea that, like, we have to change the model to reduce the overall stress, or you're just going to take all of those things that you gathered during the day home with you, and it's going to make it more difficult for you to decompress from the day. So fixing the culture in the practice, making everyone glad to be at work, like you said. The work has to work so that the life part of it, right, can be easier to sustain.
Yeah, focusing on the work-life harmony part, I believe that when we can make work an environment that people want to come into, you know, our people know when they walk into the emergency room, it's probably going to be a hard day, but they love the energy, the collaboration, the teamwork that helps them get there. And so the adrenaline rush is worth it. You know, we also work less days a month because of the severe intensity and the long hours that we have, since we work 12 to 13-hour shifts.
I mean, that's great that you guys have recognized that and reduced total working days during the month. I mean, that's probably not true of every emergency hospital out there.
Yeah.
So,
yeah, our full-time doctors usually work like 12 shifts a month. So,
definitely need the decompression time for sure.
Yes.
Because it takes more time to turn off too once you leave.
Yeah, it does. Mentally and in your body, like physically, you do
Supercharged.
get that like adrenaline and cortisol, and that's normal. That's part of it. That's part of what draws us to ER, and you know, the people that love it. That's part of it. And how do we have that awareness and build skills to transition home? Yeah. For me, when I talk about work-life balance, I talk a lot about being present and cultivating the ability to be present. So when I'm at work, I am at work. I can be in the moment, and I can, you know, serve the purpose I'm there to serve. And then when I'm home, I'm also in the moment, and I'm totally able to be present and in my life, my real life.
Being able to turn it off. I remember, you know, remember in my prior job, you know, emailing clients from home. Clients have my cell phone number. I routinely would call me, and it definitely informed what I wanted to create at Modern Animal, which is, you know, our doctors don't follow up with clients when they're not working. We never ask that of them, and that's one of the functions of our virtual doctors. They're doing that follow up for our doctors. When you're off, and you should be able to decompress and take that time.
Yeah. And I talk to my doctors about, know thyself. If you are doing some records at home, if you are calling a client, the next day to follow up, and that brings you immense satisfaction, and that's a choice you're actively making, that's that harmony, that integration. Again, I'll never shame or blame you for that, but we need to talk about it, and we need to have that awareness, because it's such a slippery slope in a profession that's based on passion and loving it.
Yeah.
How can veterinary companies better equip the public with knowledge of what is going on in the veterinary field and its long-standing tie to struggling mental health?
I'll take that one.
Sure. I think just having conversations like this and really making ourselves more aware, we'll start sharing it with the people that we love and care about and make them more aware. I think there's opportunities in the hospital when it is really busy and clients are back there and we have 3 tabletop cases and there's a broken toenail and we run by and we're like, hey, thank you so much for your patience. We have all this going on. I think that in itself increases awareness because they see how busy we are and how intense things can be, or even if we have a coding patient and there's an owner in the back and they don't necessarily feel comfortable watching and we escort them to a room so they can feel a little bit more comfortable. I think letting people see what we experience is just the best way to create awareness.
Totally. Yes.
And by taking down those walls and those barriers that we have built up over the years, that we can take those away and just say this is what our life is like as an emergency veterinarian. And we'll have people make comments like, oh, everything dies here, or this was so traumatic, how do you see this every day, or I don't know how you euthanize, all these things. But that is our everyday life, and to some extent we have normalized it, but I think it creates an awareness in the people that come in through our buildings, and they have an appreciation for our intelligence and the skills that we have, while also the trauma that we experience on a regular basis.
So true.
That was such a hard part of the pandemic.
Yeah.
With curbside, was that disconnect, and then clients being back in the building, I did see their kind of empathy go up, and they're seeing it. And when they were in the parking lot, they're scared and stressed and anxious, understandably, and they're not seeing the work. So I love that, showing the work.
Yeah. It's transparency, right? It's just being real and being honest about what it is, and yet people definitely respect and are amazed by what we can do. I mean, we increased our prices a couple months ago, and we sent an email to all our clients, and we told them the reasons we were doing it. And one of the reasons we did it is so that we can continue to pay a fair and adequate wage to our staff. And we literally got maybe one complaint about the price increase, but we got multiple responses from clients saying, thank you so much for telling me this. I didn't know these things. Yeah. And it just means, just bringing them into the loop and then and letting them know. I mean, we already have the luxury of working in a profession that so many people revere. Let's tell them what it's all about. And I think the response will be positive.
I definitely invite those opportunities for education and dialogue with the clients when it comes up naturally, when it comes up organically, for us to provide that education. And let them in and share about our challenges and to educate.
I mean, I think people in general are kind of curious about what we do. We have this sort of fantasy profession anyways, and they want to see. It's one of the reasons our hospitals are constructed with so much glass, so that people on the sidewalk even that aren't even, bringing a patient in can see what we're doing. And I think, the response is almost always positive when they do see that.
All right, from the audience, are there opportunities to leverage data as a tool to help make a positive impact in regard to mental health within the veterinary industry?
That's such a good question.
That's a thinker.
Sounds like it came from a data scientist, maybe. I think so. I mean, I think for me as a veterinarian, understanding outcomes is really important to me. Are my patients getting better? Are my clients happy and satisfied because I'm in their life, because I'm taking care of their pet? That is going to fuel my satisfaction with my job. Not knowing those things, right? And I have to say, I feel like this is one of the downsides of emergency practice. If if you're doing your job right, you're never seeing them again,
That's
hopefully,
true.
right? So
Yeah.
you often don't know these things. And so I think, collecting data that helps you understand, like, it was amazing. Like, I had this incredible experience with Veg at 2 o'clock in the morning, and they saved my dog's life, and they made me feel comfortable every step of the way. I mean, that is going to make, if I was that doctor, right, I would feel so much better about the job I had done. And going back to that idea of perfectionism and what I need to believe about myself, I think that would be very helpful to me. So I think there definitely are ways to leverage it for sure.
Yeah, I agree.
Sharing that with the team too is important, right? One of the things we do, our business is app-based. Everybody who comes to Modern Animal downloads the app, joins through the app. When you leave Modern Animal, you get asked, how was your experience? And we provide that back to our team, and we say, guys, you got 110 five-star ratings today, and this is what people said about their experience. Here's the data showing the team what kind of job they're doing. And they absolutely love it, right?
Yeah, we do something similar so they can just feel how much of an impact they make and how much it means to our customers when we can change their animal's life.
Totally.
That's awesome. There are definitely tools out there too. I'll just say, regarding mental health, there's tools that we as veterinary social workers use for well-being individually. I know AVMA has some great stuff on their site that we've implemented at Sage, we've utilized. So we definitely want to have both that qualitative and quantitative data to increase awareness, like we talked about, starting with that awareness. All right, as we start to wrap up, final thoughts, mental health impacting all of us. Any final thoughts on this area in your field? And any other thoughts you want to add?
Well, I guess I would just say that we got to do something. I mean, your question earlier, I don't think we really talked about what is the industry's responsibility as much as we could have delved in. That's probably another conversation for another day or two, maybe even. But we are losing people from this profession who, like we've already said, have spent their lives and dedicated their lives and a whole lot of their money also, right, to becoming veterinarians. And it's not a sustainable profession at this point in time, on an aggregate level. So we have to really start engaging and having these conversations on a broader scale across the industry, I think.
Yeah, I think 40% was the most recent study that I read of veterinarians actively looking to leave the profession and do something else. So yeah, I think you're right. It's a high percentage, So I think this is great that we're coming together. A few other resources that have just come to mind as we're having this final discussion on what resources can we provide to our teams and to the industry. QPR training, question, persuade, refer. It's a suicide prevention training that you can do. We offer that for free for our employees, and it's super helpful. And like you said, like the online therapy, take initiative, like help your teams, help yourself, help you, go out of your way to make sure that you're using those resources, because change takes time and it's a process, it's a thought process, it's changing mindset. And I think we're all here today because we care about it and we're actively looking to make a change in the industry.
Yeah.
And so let's just keep doing our best one day at a time, and that's what really matters.
I love that.
Yes, and making it normal, help seeking, using what's available, talking about it, having conversations just like this, like you said. Yeah. All right, thank you again to both of you for your time. Your perspective is really valuable. Thank you to everyone joining, taking in this conversation. You're already increasing that awareness, building important awareness, and prioritizing mental health. So thank you again.
Thank you.
Thank you.
Thanks, everybody.